So I came to this city. At that time we had about 130,000 inhabitants, but no hospital. I did work on Shabbat, on Yom Kippur, on Rosh Hashanah. I was not going to the synagogue almost because there were so many people. I was the only doctor. And so all the big people, the personalities, saw that a hospital could save lives. So they urged me to make a hospital. We have a connection to the patient. We are a small hospital. You have a contact with each patients, and these people, the people are feeling that. So we are specializing what I call in value of life.
I've been here for the last 9 years and watched this hospital growing from a very small facility, basically a maternity hospital with elements of internal medicine and surgery. Nowadays we are a almost 300 bed general hospital with all the basic departments. The population we're catering for has grown largely. It's not only Bnei Brak, it's some other settlements near Jerusalem and in the south of the country. So our community is now maybe 250,000 people.
And I always say like that, we have quite a nice hospital. We have wonderful doctors, but we have the best patients.
Medically, it is perfect. 20 years ago, it started as a maternity hospital, only for deliveries, only a Chadar Leda, only maternity hospital. And they had, in those days, 5 delivery rooms. Today, we have 14 delivery rooms and about 1,000 deliveries a month. The treatment is very particular, very personal, very professional on one hand, with a warm heart on the other side. And this makes it different from many other hospitals and many other gynecological departments and delivery rooms.
It's my second birth here, and I came especially for here because I had such a good experience last time. And even though you can see I'm not the regular, I don't know, audience around here, I recommend highly. And it's a different attitude.
Walking around the hospital, seeing the patients, seeing the staff, seeing how they are working and seeing how they are treated gives me enormous pride and nachas, because it's just doing a really good job and very effectively with soul, with neshama, with regesh, with feeling. And that's what medicine is all about.
There was a very big rabbi here called Chazon Ish. So they asked him, tell me, what's life? Life means to help others. Being here, I can help a lot of people. They're coming, advices, I go to the department, they can talk. So to help others, that's why I'm here. Ki lechach notzorti. That's why I was born.
We try harder, I would say. Not only to save lives, but also to make the patients stay as comfortable as possible.
My mother is 102 years old. 3 weeks ago, she couldn't breathe well. Her situation was crucial. We called an ambulance. When he asked us to which hospital we want to go, we didn't even think twice. We knew immediately, only to Mayanei Hayeshua. I told them to come to Mayanei Hayeshua because I knew if they take her to any other hospital, I knew when she comes there and they will see how old she is, they will look at us and say, so what do you want? She lived enough. This will be the answer. In Mayanei Hayeshua, they don't ask your age. They see a sick people, they treat her. Let her have more days. God didn't say this is it. The hospital brought my mother back to life when we were sure she's gone. My mother is 102 and she came back to life.
You see, I'm building here now a new hospital for psychiatric patients because the main thing is not to heal them or to help them. There's a big, if you ask me as a doctor, all these 60 years in medicine, what's the biggest revolution in medicine? No doubt psychiatry. Because 30 years ago, somebody had a schizophrenia, you put them in a hole, you saw them again at the Lavaya, you saw them again. But today you can help 95% of these people. We have already over 20,000 patients, and we'll have much more than 100,000.
Now, we have broken a taboo about psychiatry in the religious community in Israel. We were the first to establish psychiatric clinics, both pediatric and adults, open. And at the beginning, people would come in and sneak into the clinics. We don't have inpatients as yet. The new hospital will take care of that. And also it will free a lot of space for us in this building to open new services, because we are very short of space right now.
People would hide as much as possible away from any semblance of being involved with any sort of mental or psychological treatment. So much so that families would hide their children for even decades in the house and not let them be a functioning part of society. For these people who are stigmatized, it's essential and life-saving. We're now almost 11 years later. We've started with an adult clinic. We now have approximately 50 to 60 employees. We have thousands and thousands of people coming. We have a waiting list really out the door for all the services we provide.
Seeing these families, how they develop as a family, as parents, how they go back to the community and they're in a much better place, and the other children don't come to us afterwards. This only one child who comes, gets treatment, the family gets the treatment that they need, and you see them going back differently. And it's really rewarding, that part of the work.
Being part of and instrumental in creating the Mordechai Fachler Family Therapy Unit, for me, it's much more than a job. It's a mission, it's a passion, and it's amazing that it's happening so quickly. We are definitely within the mental health unit, a national organization, national institution, a national center, and that can only grow from strength to strength.
But the fact that you can help and save lives, I mean, there's no doubt every day we are saving here dozens of lives. It can be a newborn, it can be an old man, it can be somebody by an operation. So saving lives. So it's a good feeling to be a part of a good thing.
It's a pioneering hospital. It breaks ground. It does things that others don't do, and it does it well. And it makes the impact, and it changes things. My late brother Mordechai, his whole life was based on impacting on people, breaking ground, pioneering in his own way, in psychotherapy, in psychology, in counseling, in helping others on an educational basis, on a personal basis, on every possible level of life. And we all got that from my parents. And so creating a family therapy unit in memory of my late brother Mordechai is certainly fitting. But I think it goes back to my parents. My parents, our parents, are amazing people. They've been pioneers all their lives, and they gave us that pioneering spirit. But why hear it from me? Let's hear it from Dad.